On the Health Watch, families of children with a rare disease that impacts their brains are hoping new legislation in Sacramento will help them get the medicine they need. The bill would require health insurance companies to cover the disease and the treatments. As Lynn Ramirez reports, it's been a long struggle for one South Bay family.
This is the magic IVIG. This is what we've been waiting for. They finally flew it in last night.
For 26-year-old Tessa Gallo, waiting 4 months for a shipment of medication is just part of her medical ordeal. There's the painful IV hookup.
How long did it take you this time?
A long time.
It took like, I think, close to 3 hours to find her vein.
And the 12 hours it takes to get the medication infused. And on this day, it all became too much.
This is the hardest disease I've ever been through. It's not easy for me.
It's not that you've been brave.
Tessa suffers from an autoimmune disorder called PANS, or Pediatric Acute Onset Neuropsychiatric Syndrome. It struck her one day when she was a happy, healthy 13-year-old.
Overnight, on July 8th, 2011, Tessa dramatically changed.
The disease is marked by a sudden, devastating onset when a patient's antibodies attack the parts of their brain that regulate behavior, causing OCD, tics, and other symptoms.
Became psychotic and developmentally delayed, and I knew something was wrong. Unfortunately, it took about 10 months to figure out her diagnosis, that it was actually not bipolar or schizophrenia. It was actually something called PANS.
Tessa's mother and advocate, Terry Downing, says she was in and out of psych wards and given many drugs for what doctors thought was a mental illness. That is, until a new team of doctors at Lucille Packard suspected PANS.
They started a clinic after her and started giving her something called IVIG and rituximab. Both very expensive drugs.
The drugs ease Tessa's symptoms and make dramatic positive changes in many other patients with PANS and a related condition called PANDAS, which starts as a strep infection. Tessa takes the medicine once every 3 months, but Downing says it's been a struggle since day one to get the drugs covered by insurance companies.
Never in a million years did I think 13 years later that I would still be fighting for the same medication.
The treatment is not inexpensive. I'm the first to say that.
Dr. Mark Pasternak is an associate professor of pediatrics at Harvard University and one of the nation's leading researchers into PANS and PANDAS. He says there's a lot the wider medical community still doesn't know about the disease, and patients are often denied coverage, with drug costs being a major factor.
For teenagers, it's probably close to $15,000 of treatment. But given that they often prevent psychiatric hospitalizations, they're cost effective.
11 states have passed legislation requiring insurance companies to cover PANS and PANDAS. California could be next.
California has a core group of parents working hard now to get AB 2105.
Dr. Angela Tang is also the mother of a PANDAS patient who says the California bill would require insurance companies to cover doctor-prescribed treatments, which could include IVIG and other drugs.
If Governor Newsom will sign this law, we will be able to be a role model and a very large domino in getting the rest of the states, the 38 other states without protections, to get them to follow suit.
If passed, the legislation would help patients like Tessa get the medicine when they need it.
When I'm waiting for the medicine, I feel like upset, kind of sad that it didn't come and stuff like that.
Although she suffered some brain damage because of her earlier misdiagnosis and treatment delays, Tessa's enrolled in the College of Adaptive Arts and works part-time in a bakery. Doctors say her therapies are working, and for now, the disease is in remission.
We did reach out to Tessa's health insurance provider for comment on this, but so far have not heard back.